Okay, welcome back to part 2 of Chemotherapeutics of Malignant Diseases. Continuing on. So we're looking at the cell. There are different cancer drugs that work at different parts of the cell, and some are non-cell cycle specific, such as the DNA alkylating drugs, and some do work in the cell cycle. Most intercalating drugs are non-specific drugs, for example. So let's look here. We can see that for inhibitors of DNA synthesis and integrity, there are antimetabolites and folate pathway inhibitors and topoisomerase inhibitors. These are for the inhibitors of DNA synthesis and integrity. So this would be working in the S phase. Then there are DNA damaging agents such as alkylating agents and anti-tumor antibiotics and platinum complexes. I might be confused as to where these are working. Anyway, DNA damaging agents, alkylating agents, anti-tumor antibiotics and platinum complexes. Then we have the inhibitors of microtubule function, and these are the vinca alkaloids and the taxanes. So these are working in the M phase, in the mitosis phase. Next we have the cell cycle intervals and anti-cancer drugs. Interference, so we're looking at what part of the cell stages these drugs intervene. For example, in the S phase, these are agents binding to DNA to stop DNA synthesis, such as the alkylating agents, the anti-tumor antibiotics, the platinum compounds, and miscellaneous others. These are agents that bind to DNA. Then in the G1 phase, the synthesis of components of DNA, we have the antimetabolites. This is in the first growth phase. So these stop cells making the building blocks of DNA: methotrexate, azothioprine, 6-MP, 6-TG, and 5-FU, the purine and pyrimidines. These are the antimetabolites that are working in the G1 phase. Then in the G2 phase, the synthesis of components for cell division, we have the microtubule inhibitors. These are stopping the cells from making components needed to separate. So the vinca alkaloids such as vinblastine, vincristine, vinoelbine, and doxytaxol and paclitaxel. These are working in the G2 phase. So try to remember these. These are really important. Moving on, so talking about the anti-cancer drugs, there are 9 we're going to talk about today. The first one is the alkylating agents such as cyclophosphamide and cisplatin. 2. Antimetabolites, methotrexate. 3. Cytotoxic antibiotics such as which are the anthracyclines. And 4. Mitosis inhibitors, vincristine and the taxanes. And 5. The topoisomerase inhibitors 1 and 2, topotecan and etoposide. And number 6, hormones, corticoids, tamoxifen, flutamide. These are the hormones. Number 7, the enzymes and other drugs such as asparaginase and procarbazine and hydroxyurea. And number 8, the PTK inhibitors such as imatinib. And number 9, monoclonal antibodies such as rituximab and trastuzumab. Okay, moving on. We're first going to talk about the alkylating agents. So the main ones here are cyclophosphamide and the platinum derivatives such as cisplatin and carboplatin. And other important ones are the derivatives of the nitrosourea such as the lomocystine and carmocystine. There are others that are important too, pay attention to, but let's move on. Mechanism of action. So these work by intra-chain cross-linking. So the inference with transcription and replication during the S phase and G2 block. This is when these are working during the synthesis phase. So we're talking about right before mitosis. So G2 is right before mitosis, which will lead to apoptosis. So we have looked up the meaning of inter and intra-chain cross-linking, but remember the cross-linking is associated with these alkylating agents. So an example of this DNA cross-linking can be seen here, the joining of two or more molecules by a covalent bond. Okay, so what I was saying before, intrastrand is within the same strand, or in the opposite strand, two strands, it would be called interstrand. That makes sense. So inter between two and intra within the same one. And the cross-links can also occur between DNA and protein. Okay, so moving on. So the alkylating agents, what are the side effects? Myelosuppression, GI toxicity. We see this in most of the cancer drugs. Inhibition of gametogenesis, sterility in males, and the secondary malignancy such as acute leukemias. So let's look at cyclophosphamide, mustard gas. So this is frequently used, and it is also used as an immunosuppressive agent. And there is in the liver P450, cytochrome P450 activation. And this is given by mouth, IV, or IM. And one derivative of this is the isofamide. So remember that for cyclophosphamide, remember isofamide. What are the side effects for cyclophosphamide? Myeloppression, GI toxicity, hemorrhagic cystitis, and this is because of acrolein, but this can be relieved by mesna if you are giving it before, not after it happens, but as a prevention measure you can give mesna. So let's look back and compare these. So cyclophosphamide, so this is the alkylating agents, don't get confused here. So cyclophosphamide is one of the main alkylating agents. And the general side effects of alkylating agents are here, and this is shown here in the side effects of cyclophosphamide. So remember about the hemorrhagic cystitis and mesna for cyclophosphamide. So the clinical applications of cyclophosphamide, breast cancer, ovarian cancer, non-Hodgkin's lymphoma, chronic lymphocytic leukemia, and soft cell sarcoma, neuroblastoma, Wilms tumor, and rhabdomyosarcoma. Okay, let's take a break here and we'll come back and start with cisplatin.